Good evening, all of you. First of all, I'm really thankful to IOMP, Dr. Bezak, Dr. Arun Chogle, who has given me an opportunity to be in this week and deliver a talk on radioactive waste management and associated radiation protection in nuclear medicine. This is really very important topic whenever we deal with radioactive waste being handled in Department of Nuclear Medicine. What is the objective of this particular presentation? That should be known to us first. The important thing is to deal with radioactive waste in a manner that protects human health and the environment without imposing undue burdens on future generation and do not exceed the prescribed limit. The second objective is the disposal shall be undertaken in accordance with the rules prescribed by the regulatory bodies of the country where we live or where we handle this waste. The other important thing is we should know about the regulation. What is the national legal framework? And it has to be managed with an appropriate national legal framework only. Second important thing, that the facilities which are governing this waste, we have to ensure the safety during their lifetime. Now we come across what is called radioactive waste. That is one of the most important things before we go further ahead. Radioactive waste is a term used to describe the radioactive substance or the substance contaminated with radioactivity for which no further use is planned or considered. It could be in any physical form like solid, liquid, or gas. It has activity concentration, and contamination higher than the level for clearance from regulatory requirements. Most radioactive waste comes from nuclear industries, as we all know very well. The rest comes from the use of radioactive sources in radiation facilities like hospitals, universities, and some non-nuclear industries and defense-related activities. And in today's lecture, I'm going to cover this particular aspects only. Now comes in what are different natures of radioactive waste. First and foremost thing, as we all know, is called solid radioactive waste. What is solid radioactive waste? It is in the form of combustible and non-combustible. It may be in the form of compactable and non-compactable. Plastic, paper, bandages, gloves, filter, used radiochemical containers, equipment, they're all called under solid radioactive waste. Glass, metallic items such as needles, spent radioactive generators in the Department of Nuclear Medicine, plant residues, soil samples, charcoal traps, fume hood filters, resins, columns, matrix gel, chromatography plates, excreta, used linen from the patient treated with radioiodine. This all comes under the category of solid radioactive waste. Then comes liquid radioactive waste, which is also one of the form of radioactive waste. It is in the either aqueous form or organic form. Lab washings, radioactive spills, decontamination solutions, etc., and surplus discarded solution of radiochemical, liquid scintillation solutions, residues from organic synthesis, urine of patients, body fluid, oral discharges, effluents from therapy ward of patient treated radioiodine, they all comes under the category of liquid radioactive waste. Then we come across the third and important waste category, which is called gaseous radioactive waste. Usually it is seen that gaseous radioactive waste are in low activity. Exhaust from fume hoods handling radioisotopes, mainly iodine 131 and 125, because we all know iodine is volatile in nature. Definitely the fumes comes out and it requires handling in fume hoods. Exhaust from incinerators, when we handle tritium or carbon-14, that also generates waste from the incinerator. Medical cyclotron facility, when we produce radioisotope for making the isotope for PET CTs or SPECT CTs, then comes under the waste being comes under medical cyclotron. Exhaust of radioactive laboratory, any kind of laboratory where we are handling the unsealed radionuclides that may also discharge a waste in the form of gas. Then disused radioactive sources is also a kind of waste, because here when the sources which are no longer in use for patient treatment or for any other purposes, then it considered in the category of waste, like iridium 192, like sources with contamination hazard like radium 226, cesium 137, krypton 85, long-lived sources like cobalt 60 in case of radiotherapy. In case of industrial application, I'm just touching about that. This also comes under the waste in case of radiation facilities. So it means that a human environment, a human is being exposed with different kind of waste in the environment, maybe from nuclear, maybe from waste from the radiation facility. Thus, it alarms that radioactive waste should be handled in a very proper way so that it should not give undue hazard, undue exposure to a human being. Then what are the categorization we have in our country, that is in India? We have 5 different categories, which has been solid, liquid, and gas, and depends on the surface dose or activity concentration or activity in becquerel per meter cube. You can see 1, 2, 3, 4, 5 the category, and those surface dose which is more than 20 milligram per hour comes under category 3. Similarly, if the activity concentration is in this range, it comes under category 3. If the activity concentration of the gaseous is in this range, it comes under category 3. As the surface dose increases, activity concentration increases, the categorization changes of the waste being generated. Now, when we talk about International Atomic Energy Agency, they also categorize waste in different form. Maybe called exempt waste, maybe low and intermediate level waste, short-lived waste, long-lived waste, high-level waste, and the typical characteristics of the waste being generated and what are the disposal options available. So every country can have the categorization based on the regulatory authority under which they are being regulated, and usually we are can follow the IAEA categorization radioactive waste guidelines also. What are the general requirements towards radioactive waste material? The important thing we should know, the radioactive waste shall be managed in a way that secures an acceptable level of protection for human health. Radioactive waste shall be managed in such a way as to provide acceptable level of protection for the environment. Radioactive waste shall be managed in such a way as to ensure that possible effects on human health beyond national borders will be taken into account. Again, the waste should be managed in such a way that predicted impacts on the health of future generation will not be greater than the relevant level of impact that are acceptable today. Radioactive waste, again, should be managed or shall be managed with an appropriate national legal framework, including clear allocation responsibilities and provision of independent regulatory functions. It should be kept as a minimum practicable. Interdependency among all steps in radioactive waste generation and management shall be taken into account. The safety of the facilities for radioactive waste management shall be appropriately assured during their lifetime when the waste is being stored in the facility, whether it is the waste management agencies or till it has gone to the waste management agencies in the radiation facilities. Now, when we talk about the waste management, the important thing is how the management of this waste is being carried out. First and foremost thing is collection, segregation from non-active waste, segregation by type and half-life, collect them in a different collection bins, collect the solid waste in disposable polythene, and as far as liquid waste is concerned, use polythene carboys. Then the important principle which we all follow and which are supposed to be followed for disposal is dilute and disperse, delay and decay, and concentrate and contain. These are three different principles on which the waste disposals are being carried out. Now, first we should know, as far as solid is concerned, when we follow dilute and disperse guideline, if the activity of the article is less than 50 kilobecquerel or the package in which the waste is there is less than 5 megabecquerel per meter cube, then may be considered to as an ordinary waste. Otherwise, it requires again waste disposable rules. Similarly, in case of liquid, if the waste is less than 37 kilobecquerel, then it can be disposed of into the sanitary sewerage system with adequate flushing with water. Now comes delay and decay, when we are supposed to follow delay and decay mechanism. If the waste being generated or the radioactive isotope or substance it is there is having less than 1 month half-life, then properly ventilated and shielded or 10 half-lives, then it is to store for 10 half-lives, the rule of thumb says, and then finally disposed of as a low activity solid radioactive waste. When we call as concentrate and contain, if the half-life is more than 1 month, then it has to be suitably designed with a labeled container and kept, and then you have to bury in exclusively approved burial sites, which is generally maintained in our country in the waste management agencies. These are the certain disposal limits for burial which is being followed for tritium, carbon, sodium, phosphorus, sulfur 35, calcium, molybdenum and technetium, iodine 130 for 131. This is the activity which is required, that it requires can be buried in a pit. Similarly, for sanitary sewerage systems, these are the different radioisotopes, and this is the maximal limit for total discharge and average monthly concentration which you can handle. In case of iodine 131, it is 22.2 megabecquerel per meter cube. Then waste can be allowed. And in case of moly, it should be 185 megabecquerel per meter cube in case of technetiums. Thus, before we follow the average monthly concentration or daily discharge limit, for these isotopes, then this should be less than this, and for average monthly should be less than this, but with a note that the gross quantity of radioactive material released into the sewerage system by any hospital should not exceed 1 curie or 37 gigabecquerel in a year. Incineration is also one of the way where the management of waste takes place. It is generally the waste being generated from liquid scintillation system. Activity concentration should be less than 5 megabecquerel per meter cube. Disposed of with the day hospital waste going to an ordinary incinerator. Incinerators should operate under controlled segregated places to protect atmosphere from radioactivity, and whatever the ashes being generated during incineration, that has to be disposed of separately as a radioactive waste. Then comes gaseous waste disposal. As I earlier told, that there are certain radionuclides which are basically volatile in nature, like iodine. Iodine, these are gaseous in form, and they generally being used like technetium aerosols, which are sometimes used for clinical purposes. They're likely to give some radioactive, so these sources likely to give some waste. And it has been well said, whenever we are handling such kinds of unsealed radionuclide, which are likely to be volatile in nature, that has to be open under a fume mode connected through duct line to highest rooftop exit. And finally, this whatever gas is being passed out, it has to pass out from charcoal or particular air filter before release into the atmosphere. Then comes a nuclear medicine. We all know, as far as cancer thyroid patients are concerned, or thyroid cancer patient, when treated with iodine 131, they have to be isolated or they have to be kept in a ward till the activity level comes down below the limit prescribed by the competent authority of the National Regulatory Authority. So what are the contaminated articles in the room disposed of as a radioactive waste when activity less than, this is the contamination level per 100 square centimeter. Whatever the linens being generated like patient linens and towels stored for 90 days and they have to serve it before returning to the laundry. Similarly, disposable personal item, eating utensils and food, example, toothbrush, toothpaste, mouthwash, combs, these all are considered as waste because whatever the iodine which has been secreted from saliva, whatever the activity which is coming through the perspiration of the human body, that all lead to the waste being generated. And we have to be very, very careful when we have to consider this kind of waste, how to dispose of. All protective covering like telephone covering, nurse call devices, TV remote controls, packets, room floors, door handles and guardrails. Bathroom facility must be removed and checked for contamination through GM or wipe test. Then sometimes it may so happen when the patient is being treated with iodine 131 and because of some unusual incidences, the patient dies. Then the important role comes of radiation safety officer or radiation protection officer is how to handle the cadaver which is containing the waste. A thyroid cancer when dies with iodine 131, job is to inform the radiation safety officer or a nuclear medicine professional or a physician. All objects, clothes, documents, etc. that might have been in contact with the disease must be tested for contamination. It may be expedient to wrap the cadaver in a waterproof material immediately after death to prevent spread of contaminated body fluids. High activity in thyroid and metastatic sites, we have to try to remove if we can able to remove. Once activity is within the limit, then the dead body may be handed over for disposal through burial or cremation to the relatives. In case level is very high, in such case, the corpse or cadaver is retained in the hospital mortuary until the activity decays to the safe limit after embalming to the bodies. This is also a point of concern whenever some experiments are being carried out on animals for the new radiopharmaceutical before like biodistribution study before really putting up administration to the patients. In case if animal dies or animal sacrifice, then you cannot just discard the animal body like that. Again, it acts as a waste. Make sure that bags are not punctured and the outer bag is free of blood. Secure closed bag with tape. Package in small amounts. Add coagulants or absorbent to reduce liquids. Bag should be labeled with radioactive text when picked up. The thing is, as I informed, that there are certain kind of sealed sources when they are not in use, like check sources for quality assurance, or like iridium 190 not being used, or cobalt 60, then you cannot dispose that waste as a general waste because they are radioactive waste. Their container also cannot be just disposed of waste. Sealed sources should be labeled with the content and will be collected separately and may be returned to the supplier. This is the policy which is to be followed, has to be followed, that whatever the disused sources are there, they are supposed to be go back to the country of origin from where it has come. Whenever the pickup of radioactive waste is decided, do not place lead shielding in radioactive waste container. To prepare for pickup, remove any plastic, perform contamination survey, cross out the radiation label if it is not contaminated, place lead in a cardboard box or other proper container. Radioactive waste tag will be pasted when picked up is arranged, otherwise not. So what is radioactive waste tag? RSO must have a tag for identifying the content of radioactive waste. One must know its identity and its activity. Dry waste activity estimate 10 to 20% active used in experiment to end up as a solid waste. We should know it also happens. Liquid waste activity calculate by counting a sample of waste in liquid scintillation counter or gamma counter, and again you have to put a tag on it whatever the waste being generated. Then comes labeling. Mark all items used to manipulate or store radioactive material. Label all contaminated items. Remove all radiation label and warnings on containers that no longer contain radioactive material and are not contaminated. We are not just supposed to keep any waste labeling. If at all it has to give the general waste as per the guideline, you have to remove the radioactive label from it. Label must be provide sufficient information on the container to minimize exposure and to make sure all proper precautions have been taken. That what radionuclide it is having, what is the activity, what is the radiation level, what is the date, and with a radioactive symbol. These are different warning signs that needs to be pasted from the radioactive waste container or the waste being generated so that it helps the waste management agency or the concerned pickup that it has to be kept not with the general waste. In summary, I would like to say that radioactive waste to be dealt in such a way that it not only protects the human health but the environment too. Transportation is performed according to the categorized level of the source. All source must be accounted for receipt, storage, security and movement. Radioactive waste must be handled, stored and disposed of depending on the type of source, whether it is liquid, solid, aseptic, patient discharge, cyclotron waste, in compliance with the local procedure based on national regulations. To get rid of worry of radiation, the best medicine is stick to the radiation protection rule prescribed by the regulatory authorities. Thank you very much again for a patient hearing. And again, I am thanking to IOMP and Dr. Bezag and Arun Chogle, who has given me an opportunity to present this talk to all of you. Thank you very much.